According to the American Obesity Association, there's an epidemic facing the U.S. with over 74% of our population overweight, and over 30% of those people are classified as obese. We spoke with Dr. Michael Snyder at Rose Medical Center, who explains why some people might choose weight loss surgery.
People choose weight loss surgery really for three reasons. Number one is their BMI or body mass index has gotten to a point where their weight is negatively affecting their health. So their height-weight ratio is 35 to 40 plus for most procedures or 30 plus for banding procedures. Number two is medical problems that are notably affecting their health that are due to or aggravated by their weight. And those include things that we commonly understand, such as diabetes, hypertension, high cholesterol, high triglycerides, but also things like depression, joint pain, sleep apnea, urinary stress. And number three is that the weight is really messing with their life, that it's affecting how they feel about themselves, what they do, what they're capable of doing, what they want to do. And it's all so much that those things, three things added up, make them realize that they need to do something.
Dr. Snyder discusses the surgical options currently available for patients.
When you think of bariatric surgery or obesity surgery, there are really two ways to lose weight. There's restrictive, where you eat less, and malabsorptive, where you absorb less. And there's also the third, which is restrictive plus malabsorptive. The restrictive procedures that are commonly accepted are the banding procedures, such as the lap band and the Realize band. There's also the sleeve gastrectomy, which is where we make a tube out of the stomach and make it so you eat functionally less. And there's the most common procedure done in the U.S. now, which is the gastric bypass procedure, which is both restrictive, where you eat less, and malabsorptive, where you absorb a little bit less. So that's really how we break it down. Restriction and malabsorption, and what component of each you want to get the results you need. The real art of the process is not having a procedure. Obviously, you want to go to a center of excellence, be with someone you trust, make sure that you're part of a team that's able to give you the care you need. But the real difference is how you live your life afterwards. That's really where we say where the rubber hits the road. It's about making sure that you're making reasonable changes in your lifestyle with dietary changes and increasing activity, and making sure that you're with a team that's going to give you the care and vigilance you need to find the success within your personal life.
Dr. Snyder gave us some insight on what is on the horizon for bariatric surgery.
There are things that are coming up like plication procedures, where we fold the stomach in, even associated with other procedures we do. There's some hybrid procedures that are being done, banding over bypassing. And there's also, we're getting better and better at doing it with less. Single incision and minimal incision laparoscopic surgery. It's really quite an amazing time.
Dr. Snyder explained his philosophy of caring for bariatric patients.
The main philosophy of care is making sure that you get access to care such that the care can be personalized to make the tool work for you. Bariatric surgery is just a tool, and it's a relatively simple tool. You're eating less or maybe absorbing a little bit less. But the reality is how you use it and how you're taught to use it with that constant vigilance and tailoring to your lifestyle and your needs. That's really the critically important aspect, and it's got to be done in a humane fashion. You're not overweight because you did something wrong. You're overweight because of how you're wired, and our job is to help you change your life to make that wiring work better.